Hi, I am Sophia, and I will be talking about Salmonella enterica. So, what is it? So, Salmonella is a bacteria. It is in the bacteria family. It is a motile cell, meaning that it has a flagella at the end so that it can move around the body. It is non spore forming and it is rod shaped. This bacteria is also gram negative. So, how does it spread? When the bacteria has been ingested, it forms a colony. So, this type of bacteria has to be ingested in order for it to even affect your body. When it goes into your body, it forms a colony in the large and small intestine. So, salmonellosis is one of the most common foodborne infections in the US, and it is spread by food, water, animals, and sometimes from person to person in fecal matter. 94% of salmonellosis is transmitted by food like undercooked poultry, old beef, bad milk, and eggs. So, you may be asking, how long does salmonella last? Well, the incubation period is about 12 to 72 hours. So, if you have a meal at about 7 p.m., that next day around 7 to 8 o'clock, you're going to feel the side effects of what you ate the night before. The illness can last up to 4 to 7 days, and if the infection does spread to your bloodstream and organs, the duration and severity of the infection will grow depending on if you have a compromised immune system or not. So, what are some signs and symptoms? So, the first things you're going to start noticing about your body is you're going to start having chills and abdominal cramps straight away. You're going to start feeling nauseous and have a headache. Further on, you're going to get a fever, you're going to start vomiting, having diarrhea, and sometimes finding blood in your stool. This is just your body trying to excrete any type of bacteria out of your body as soon as it can, just because it is making you uncomfortable. And once the bad cells do get out and the white blood cells are trying its hardest to excrete that bacteria ASAP. So, what is a type of diagnosis? Well, the bacteria can't just be based off symptoms, even though most people just look at their past food decisions before going to the doctor because most people know when they have salmonella. But if you did want to get a diagnosis from a doctor, the lab is part of a patient's stool, and what they do is they just test it to see if it's positive for bacteria. But only about 3 to 4% of salmonella infections are lab confirmed, so it's just mostly people just thinking back to what they ate and if it really was fully cooked or not. What are the causes of salmonella? So, one of the biggest causes is not consuming fully cooked meals. So, people will be cooking meals and they'll be eating undercooked food or unpasteurized milk products. And this is just one of the easiest ways you can get salmonella is not cooking your chicken or pork all the way or eating raw eggs. That's just not the smartest way that people get it. But some of the other causes, are not washing your hands after using the restroom or changing a diaper. Especially when you're touching fecal matter, you definitely need to be washing your hands. Not washing your hands after touching raw meat or eggs. If you're putting your hands by your mouth, if you ingest some of that bacteria, you're going to get salmonella. Cross contamination between foods using a dirty knife or cutting board. Lots of people do this and they don't know that actually the moisture and stuff that's on these meats that you're cutting into, if you put that on something else and you don't cook it per se, it could still get you sick. And furthermore, not washing your fruits or vegetables because they could be in some type of contaminated soil that does have salmonella and you don't want to ingest that into your body as well. So, what are the risk groups of this disease? So, most people can get over salmonella really easily, but Infants, children under 5, people over 65, and people with a compromised immune system are more likely to get salmonella, the infection, after they get exposed. So these people are more likely to get the infection into their bloodstream or other organs just because as they don't have the immunity per se as other people would, especially people with AIDS, sickle cell disease, or malaria, because their white blood cells are at high risk. They are just not the healthiest they can be, and that's why they most likely have to spend the longer time in the hospital when they get this type of infection. So, how do you treat salmonella? So, usually this is just treated at home. You don't really need a specific treatment from the doctors. Some things that really help are using heating pads on the stomach to reduce the cramps. I know when I had salmonella, one of the things that is true about it is you're very, very dehydrated because your body is just making you throw up and you're just very lethargic and not feeling yourself. So, making sure you're drinking water and having those electrolytes like Gatorade or Powerade, making sure that you're eating mild foods like bananas, soups, crackers, just things that won't be too heavy on your stomach, getting lots of rest. Rest is very, very important because that's when your body has time for healing. Taking some probiotics, like maybe a drink or yogurt would help. Taking some painkillers like Advil for your headaches or cramps, and some anti-diarrheals. You will have diarrhea with this. It's just one of the things that comes with it, and having that will help. Prevention. So during these times, washing your hands is the biggest thing, and COVID-19 really emphasizes washing your hands. And I feel like if you're not washing your hands after you use the bathroom, that's one of the ways you're going to get salmonella because you're just not paying attention afterwards. You're just doing whatever you want with whatever you touch. Preventing cross contamination, making sure that you're not cooking, cutting the raw chicken up and then putting the salad right on top of it and cutting that up, not cross contaminating things that will get you sick. Avoiding eating raw eggs, making sure that you cook them all the way, making sure they're not going bad, etc. Making sure you're cooking food all the way. This is a big one. A lot of people are kind of egotistic when it comes to cooking. Like they don't want to use temperature sticks just because they think it makes them look like they don't know what they're doing, etc. But if you really are unsure if something is done, cut into it, see if it's pink. Get a temperature stick. Those things are very accurate and they will tell you when something is done. Making sure that your food is cooked all the way is a way better option than, getting sick for the rest of the week. Making sure your food is chilled and not sitting out all day. Some people do this where they'll have this food sit out all day, open, and then they'll eat it and they'll get sick and wonder why. Well, it's because your food's been sitting out all day and bacteria started growing on it. So, just making sure you're doing all these things, and that's how you can prevent getting salmonella. And then some current or new research. Now, this type of um, infection has been around for a long time, and people back then they didn't know like if they were eating raw meat or if it wasn't cooked all the way, they were just getting sick and they were just like, oh, well, I'll get over it. But now there's been some new research finding that salmonella has a drug resistance to ampicillin, and in Michigan, they commonly use this to treat salmonella, and now they're saying that having this drug resistance, people with the infection in their bloodstream or in organs, they will have a longer recovery rate because of this resistance. But in other news, a new bioinformatic reassessment of the salmonella genome, um, that scientists have discovered 100 new proteins in that genome, which is awesome because according to their research, the small protein actually consists of 47 amino acids, and if that blueprint is switched off, the salmonella can no longer infect human cells. So that means the blood cells, it won't go into your bloodstream. It'll only affect the organs if you get the actual infection, which is way, way better than having it in your bloodstream because the recovery rate will be a lot faster if you get the infection and you will not have all the terrible side effects of being in the hospital for months. And here are my citations for all of the sources that I used in my PowerPoint. Thank you.